I will be talking about saline push technique. Very frequently we encounter this situation. Two situations. Clinical situation 1, when there are multiple calicial renal calculi, they may be situated together or they may be lying in different calyces. Now, how to take them out? Multiple renal calculi are common in kidneys like crossed renal ectopia. There are multiple stones filled up in this. All the calyces are filled up. So how to take out these stones and what should be done? Another clinical situation 2 is when you are operating, doing PCNL, some fragments they will move out to different inaccessible calyces which cannot be seen in the same track. So what to do in these situations? What I plan when there are so many calculi occupying so many calyces, I try to see which are the fixed stone and which are the mobile stones. And IVP comes in very comfortably with us because in IVP we do 5 to 6 films at an interval of maybe 15-20 minutes each, and we obtain so many different films, and maybe the stone will migrate from one place to the other in different films. So compare those films. If the stones which were together here are distributed like this or distributed like this, means they are mobile stones. Once the stones inside the pelvic calyceal system are mobile stones, we can easily bring them in front of us wherever we make an entry into the PCS. So don't make a track initially on the mobile stones. Those stones which are fixed in every film in IVU, those are the stones. You have to go up to those stones. So first of all, make your puncture to the fixed stone. After that, you see if the mobile stones can be brought in front by saline push, you can remove that. So I plan my tract aimed for retrieval of fixed stones first and adopt saline push technique for mobile stones. This saline push technique was started long ago, maybe somewhere around 90s, 91, 92, and I was quite successful. I hardly use multiple tracks like this in China, and such situation do not arise. So concept is repositioning of stone fragments by saline jet to more favorable position. If this is the staghorn stone, by mere presence of stone into these calyces will cause hydrocalycosis and the infundibuli also become wider. So if there is a stone fragment in this calyx, once you remove this stone, that can be brought in. This is the track we have made, removed all stone bulk, and now this particular stone can be saline pushed in front of you and can be removed through the same track. So this is the situation, like all these small calyceal calculi through one single track, and all these saline push, they were brought in front and they were removed. So in my practice, if there are multiple calculi, I will make one track, and then the other calyces I will meet the needle puncture, stone guided puncture on the lateral aspect of the stone, and then push with the saline. So all these calyces can be saline washed, and whatever fragments or some calyceal stones are there, they can be brought in front and can be removed. This is how the needle comes from inside from the other calyces, and it can push the stone in front of you. I will give you one example. Now these are the stones. This is in one calyx here. These 3 stones are lying in this calyx, and this stone is lying here. These infundibuli, they appear wide enough. So I feel they can be brought in. But this particular calyx has got a thin infundibulum. So what to be done for this? It may be a fixed stone. So why not in the beginning itself, we make a track onto this stone only, this stone. So see, I am making a track into this that has been punctured in C-arm 0 degree and 30 degree. You can see that I am in that calyx. Good amount of fluid is coming out. Now with the 20 ml saline, when I push, this goes into the renal pelvis. So now the things are easier. We make, where the 3 stones were there, we make a track into that. Pick out those 3 stones. And now those 2 stones which were lying in another calyx are still there. And one radiopaque shadow is seen here. So what we do is make a puncture into this particular calyx harboring 2 stones and just give a saline push. They are again in front of you. Pass the nephroscope. You can remove that. This is the picture of Percon 2018. Now this radio opacity is not looking like a stone, but it is bothering me. So make a puncture, give a saline push and it disappears. So this was the dye which was lodged over there. At the end, there are 3 punctures, 1 track and total clearance through 1 track only. So this is how, in this particular scenario, when all stones were removed, this stone was not coming in front. It was difficult to access that. You can directly puncture the stone guided puncture on the lateral aspect. It is not coming, there is a restricted mobility. So make a puncture, stone guided puncture over there, up to the stone. Check in 0 degree, 30 degree that I am at the lateral border of the stone. Take out this is a 3-part needle. So inner part of the needle has been removed, outer part is in situ, 20 ml syringe put there. Now emplat sheath has to be withdrawn because emplat sheath may be blocking the infundibulum from where the stone will come in front. So it has to be withdrawn little bit, and now the saline push. The stone is moving towards, because water comes out through the least resistance passage. So it is moving towards your emplat sheath. 2 or 3 good saline pushes, and this will come in front, and then when you see inside, the stone is hidden behind the clots and everything can be picked up and removed. This is a very good example sent by Dr. Sanjay Khadge. 2 parallel calyces having stones. This particular has been removed. Now this stone is lying in front. Concentrate what is happening. He has made a puncture, Sanjay Khadge, on the lateral aspect. Now stone 1 push and the 2nd push. So stone is in front of the same large emplat sheath and it can be fragmented and removed. By this technique, if you master, there is no need of doing, no, I will not say maybe reduced by nephroscopy or by ECIRS. All those are not necessary if you learn this technique. This situation which I showed you, there are 2 stones in the superior, 2, 3 in the middle and so many in the inferior. This is the kidney. How will we go about it? Make a needle lie on this. This is the way, if you come, you will remove maximum stone bulk. And these stones in the superior, middle and inferior can be pushed once this stone has been removed. So this is what was done in this case. The track was made over here. All these stones here, they were removed. And this stone and stone in this particular superior calyx were saline pushed. On table, complete clearance was obtained. And through the same single track, all the stones were removed. Thank you very much for patient listening.